Let's see about dengue. So, dengue viruses are spread to people through the bite of an infected Aedes species. It is a mosquito. Almost half of the world population, about 4 million people, live in areas with the risk of dengue. So, dengue virus, it is spread through the bite of an infected Aedes species mosquito. So, dengue is caused by Aedes species mosquito. So, dengue viruses are spread to people through the bite of an infected Aedes species mosquito. These mosquitoes are also spread Zika virus, chikungunya, and other viruses also. So, almost half of the world population, about 4 million people, live in areas with the risk of dengue. So, dengue is often leading cause of illness in areas with risk. So, Zika virus, chikungunya virus, and other viruses are also spread by these mosquitoes. So, dengue is caused by one of any 4 related viruses: dengue virus 1, 2, 3, and 4. A person can be infected with dengue multiple times in their life. So, a person can be infected with dengue multiple times in their life. So, the term breakbone fever was coined during Philadelphia epidemic in 1780. So, breakbone fever, it is a coined name for dengue fever. Let's see about the important symptoms of dengue. So, fever with any of the following, that is headache, nausea and vomiting, rashes, joint pain, bone pain, muscle pain, and eye pain. These are the important symptoms of dengue. So, guidelines for classifying dengue. In November 2009, WHO issued a new guideline that classifies as symptomatic cases as dengue or severe dengue. So, there is two type of dengue or severe dengue. Let's see about in detail. Dengue is defined by a combination of more than 2 clinical findings in a febrile person who travel to or lives in a dengue endemic area. So, clinical findings include nausea, vomiting, rashes, aches, and pains. So, a positive tourniquet test, leukopenia, and the following warning signs. What are the warning signs? Abdominal pain or tenderness, persistent vomiting, clinical fluid accumulation, mucosal bleeding, lethargy, restlessness, and liver enlargement. So, the presence of a warning sign may predict severe dengue in a patient. So, these are the warning signs. If more than or equal to 2 clinical findings is present, who travel to a live or risk of that dengue area, it is dengue. So, severe dengue is defined by dengue with any of the following symptoms. There is a severe plasma leakage leading to shock or fluid accumulation with respiratory distress, severe bleeding, or severe organ impairment such as elevated transaminases, that is more than 1000 international unit per liter, and impaired consciousness or heart impairment. So, if severe dengue, these are the following symptoms that is definitely present. So, severe plasma leakage lead to shock or fluid accumulation with respiratory distress, severe bleeding, or severe organ impairment, that is elevated transaminases also. So, dengue begins abruptly after a typical incubation period is 5 to 7 days, and the course follow 3 phases. One is febrile, second one is critical, and third one is convalescent phases. So, the first phase is febrile phase. So, fever typically lasts 2 to 7 days and can be biphasic. So, other signs and symptoms may include severe headache, retroorbital eye pain, muscle, joint and bone pain, macular or maculopapular rashes, and minor hemorrhagic manifestations including petechiae, ecchymosis, purpura, epistaxis, bleeding gums, hematuria, or a positive tourniquet test result. So, some patients have injected oropharynx and facial erythema in the first 24 to 48 hours after onset. So, in febrile phase, it is lost for 2 to 7 days. Here, this is the main point. So, this is the first phase in dengue. The second phase is critical phase. So, the critical phase of dengue begins at defervescence and typically lasts 24 to 48 hours. Most patients clinically improve during this phase. So, but those with substantial plasma leakage can within a few hours develop severe dengue as a result of a marked increase in vascular permeability. So, initially, physiologic compensatory mechanisms maintain adequate circulation, which narrows pulse pressure as diastolic pulse pressure increases. So, in critical phase, it lasts for 24 to 48 hours. Most patients clinically improve, but some patients with substantial plasma leakage develop severe dengue. So, patients with severe plasma leakage may have pleural effusions, ascites, hyperproteinemia, or hemoconcentration. Patients may appear to be well despite early signs of shock. So, however, once hypotension develops, systolic blood pressure rapidly declines and irreversible shock and death may ensue despite resuscitation. So, patients can also develop severe hemorrhagic manifestations including hematemesis, bloody stool, or menorrhagia. So, especially if they have bleed in prolonged shock. So, uncommon manifestations include hepatitis, myocarditis, pancreatitis, and encephalitis. This is the second phase. So, if patient have severe plasma leakage, they lead to pleural effusions, ascites, hemoproteinemia or hemoconcentration, and signs of shock. Irreversible shock is produced. There is continuation of death. So, the third phase is convalescent phase. So, as plasma leakage subsides, the patient enters the convalescent phase and begins to reabsorb extravasated intravenous fluid and pleural and abdominal effusions. As a patient's well-being improves, hemodynamic status stabilizes, although he or she may manifest bradycardia and diuresis ensures. So, the patient's hematocrit stabilizes or may fall because of the dilutional effect of the reabsorbed fluid. And the white cell count usually starts to rise, followed by a recovery of platelet count also. So, the convalescent phase, rash may desquamate and be pruritic. So, in convalescent phase, what is convalescent phase? The plasma leakage subsides, the patient enters the convalescent phase and begins to reabsorb the extravasated intravenous fluid. So, what are the warning signs? Warning signs of progression to severe dengue occur in the late febrile phase, that is, first phase, around the time of defervescence and include persistent vomiting, severe abdominal pain, fluid accumulation, mucosal bleeding, difficulty in breathing, lethargy, restlessness, postural hypotension, liver enlargement, and progressive increase in hematocrit, that is hemoconcentration. So, these are the warning signs. We have to remember these signs. So, what are the diagnoses of dengue? So, clinician should consider dengue in a patient with a clinically compatible illness and who lives in or recently traveled to a disease endemic area in the 2 weeks before symptom onset. So, patients typically present with acute onset of fever, headache, body ache, and sometimes rash spread from the trunk. So, diagnosis here is if the patient having fever and other symptoms who lives in or recently traveled to the disease endemic area in the 2 weeks before symptom onset, we have to check for other laboratory diagnosis for dengue to confirm it. So, laboratory findings commonly include leukopenia, thrombocytopenia, hyponatremia, elevated aspartate aminotransferase, and alanine aminotransferase, and also and others. So the virus can be isolated in the first week of illness, or a viral antigen to NS1 can be detected. So the mainstay is serology. So the demonstration of circulating IgM antibody provides early diagnosis, as it appears within 2 to 5 days of onset of illness and persists for 1 to 3 months. So IgM ELISA test offer reliable diagnosis. Strip immunochromatographic test for IgM is available for rapid diagnosis. IgG antibodies should be done in a paired serum sample. So IgM antibody demonstration is very very important. It providing yearly diagnosis. And what are the treatment? No treatment, no specific antiviral agents exist for dengue, and supportive care is advised. Patient should be advised to stay well hydrated and to avoid aspirin, acetyl salicylic acid, aspirin containing drugs, so and other non-steroidal anti-inflammatory drugs. So fever should be controlled with acetaminophen and tepid sponge bath. So febrile patients should avoid mosquito bite to reduce risk of further transmission. So there is no specific antiviral agents exist for dengue. Only supportive care is advised. So patient should be hydrated. And see, in severe dengue, for those who develop severe dengue, close observation and frequent monitoring in an intensive care unit may be required. Prophylactic platelet transfusion in dengue are not beneficial and may contribute to fluid overload. If there is any platelet count decrease, then we go for platelet transfusion. Otherwise, prophylactic platelet transfusion is not beneficial. So administration of corticosteroids has no demonstrated benefit and is potentially harmful to patients. Corticosteroids should not be used except in the case of autoimmune related complication. Example, hemophagocytic lymphohistiocytosis, immune thrombocytopenia, purpura. So these are the treatment modalities for dengue.